Now we're in a position that we can re-engage more of our economy. Today, we are announcing that restaurants and bars can operate at 50% capacity.
Effective next Wednesday, all businesses of any type are allowed to open 100%. Also, I am ending the statewide mask mandate.
We have 50 states in the USA, and different states can set different regulations. Unfortunately, the virus knows no borders.
The reality is that Ohioans continue to die each day from the virus. But there is something seemingly even more tragic and poignant about a death that occurs when the war is almost over.
I think as we come out of this pandemic, there is going to be a real question about how do we think about risk.
Dr. Abdul El-Sayed, an epidemiologist who ran for Michigan governor, now a podcaster and author. His latest book about Medicare for all.
If people want to get to a point where there is zero risk of getting coronavirus, that's not going to happen for a very long time, frankly, if ever.
The pandemic will end, so what should we expect? I made a list.
1, we won't know when the pandemic's officially over. Leave that to the historians of the future.
This is not the kind of thing where we declare victory and the troops come home. There's still going to be risk of transmission. It's still going to take lives, but at a far lower rate. We're still going to need to protect ourselves from it. And it's probably going to end up very similar to the flu, which started out as a roaring pandemic and now is something that unfortunately takes 50 to 70,000 lives a year. So it's going to be with us for a while.
Number 2, masks and social distancing won't end soon, if you listen to the public health people.
What's probably going to happen is that this virus is going to become endemic, meaning that we're going to need to be wearing masks for a while longer.
When that masking all clear does come, you should still keep them handy. Oveta Fuller's a virologist at the University of Michigan Medical School.
So I think there might be surges in periodic times where we might have to don our mask again. But that won't be always, all the time, because if we work together, we can reduce the amount that's in the atmosphere, reduce the number of people that are infected, and keep them from producing lots of virus that go into the environment.
3, expect more COVID variants. They'll keep popping up.
These variants are going to continue to be a wild card in our calculus. Every warm body that this virus infects is a new evolution opportunity. And because it's a new evolution opportunity, there is a real risk that we're going to have yet more transmissible and yet more deadly viruses at the same time, right?
But now we have vaccines. So, number 4, expect more vaccinations to come. More manufacturers in the game and booster shots to cover the newest variants. The challenge? Getting more to take their first round of shots.
There is a lot of vaccine hesitancy, and I just want to do some math for folks. 20% of the population is under the age of 16, so they're not eligible to receive a vaccine at all. We know that we need to get about 70 to 90% people vaccinated to achieve herd immunity through this vaccine and finally bring the pandemic to its knees. So you take 20% off the top right there, and now you're talking about 80%. That's if every single adult chooses to get vaccinated, and upwards of 25% say that they're not ready yet.
Dr. El-Sayed figures the coverage at around 50%. Problematic.
I would hope that by fall of this year that we could see that children may be vaccinated and be also have immunity. It could be, who knows, it might be something that we do like measles, mumps. At 4 years old, you get your COVID vaccine for the first time.
5, expect more misinformation. Stuff social media just can't shake.
Please share this video now.
Here, a physician who claims vaccines will change your DNA and turn people into cryptocurrency.
There's going to be and continue to be, misinformation about this thing, and we're going to have to lead with the science and the evidence and be fully 100% transparent in what is going to be a very unsure and unsettling situation because there is no perfect outcome.
Is that okay so far?
Then there's the Centers for Disease Control. That government agency has a new director.
Historically, the CDC is not very political.
And then we hear politicians, starting at the White House, talk about how there's nothing to worry about, how public health is overplaying this.
It seemed like some of that got a little bit more politicized than we've seen in the past regarding science versus point of view politically. What's in store for things now?
Coronavirus got politicized, and because of that, a lot of people lost lives and health and income and it could have been avoided. You can see the CDC turnaround already. There's public health information that's coming out. There's a single message about things. So I've seen the turnaround already, and it's very welcomed.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.